Welcome to Counterpoint. I'm Tanya Allen. As governments continue to navigate COVID-19, fully reopening and returning to school and safe social interactions, many are wrestling with the question, does everyone have to wear a mask and how effective is it? What will keep our children safe? Several jurisdictions in the world and many municipalities right here in Canada have made masks mandatory, mainly for indoor public spaces. But many private businesses are also enforcing such a policy. And we have all seen cyclists and pedestrians going for strolls sporting a mask. The question many are asking is, do masks stop the spread of COVID-19? Medical experts seem to be divided as to whether or not masks are actually effective. According to the World Health Organization, medical masks can protect people. However, they do not recommend non-medical fabric masks for widespread use among the public for the control of COVID-19. Canada's own Hospital for Sick Children, based here in Toronto, released a report suggesting masks should not be worn for children returning to school this fall. Some medical experts are more nuanced with their advice. Take, for example, BC's Dr. Bonnie Henry. She recommends the use of non-medical masks when physical distancing cannot be maintained, but has consistently stated that while they do not protect the wearer, they can help the person wearing the mask from spreading infected droplets to others. And recently, some research suggests that the benefits of wearing a mask might be outweighed by the improper wearing and re-wearing of masks. Essentially, we may be touching our masks, which are contaminated with COVID, and then actually infecting ourselves. So does the slogan, stay safe, stay healthy, wear a mask, actually ring true? What about those persons for whom the health reasons they cannot wear the masks? And what about young children? And finally, there's a growing argument of how mask wearing might be an infringement on our civil liberties. Is this valid, or should people just get with the program and do what the local health officials recommend? Providing his medical opinion on this matter is Dr. Matthew Strauss. Dr. Strauss, thank you so much for joining me today. Firstly, how do you think Canada has fared with its response to COVID?
From the beginning, I think it's been clear that COVID-19 is particularly a problem for elderly folks and folks with important comorbidities, so other medical illnesses. So we have done, in some ways, a good job in controlling the spread of the disease. But from the beginning, I was calling for more attention to be paid to those vulnerable segments and for maybe more liberality being applied to folks not in those segments. So I think that we have erred in that I think 3/4 of the COVID-19 deaths that occur in Canada happened in nursing homes, and that was foreseeable and probably preventable. I don't want to say in retrospect, I think it was clear to me, at least 6 months ago, that was what was likely to happen.
And now as data is coming out, that may back up what you're suggesting.
Oh, yeah, no, it's been corroborated again and again in every jurisdiction. And then at the same time that we've maybe paid not enough attention to vulnerable segments, we've been very heavy-handed with people who don't, frankly, have very much to fear from COVID-19. So there's a Geneva antibody study out of Switzerland that showed your chance, if you get COVID-19, your chance of dying from it if you're under 50, is about 1 in 10,000. So it's about equal to your chance of dying in a car accident this year. So we've, I think, terrified young, healthy people and deprived them of their education, deprived them of their livelihood in a counterproductive way while we've been ignoring opportunities to really protect the vulnerable.
So what is the ongoing threat of COVID then?
I think that the ongoing threat remains if you are an elderly person with important chronic medical diseases. If you are under 50, I don't, and healthy, I just don't think wherever you are that there's too much threat. Now, if you're in a location like I am, I live in Kingston, Ontario. There's been 100 cases in the last 6 months. I think for just about everyone, there's very, very little risk of COVID.
Okay, and do you think it's going to be with us to say, for example, like the seasonal flu, or is it just going to come in and out?
I do think so. So some jurisdictions like Iceland and Japan, South Korea, Australia, New Zealand, these places, most of them are islands, and many of them have been successful, perhaps, at totally eradicating it or almost totally eradicating it. I don't think that's going to be possible in Canada. We share a gigantic, large border with a populous superpower. I don't think it's going to be possible in places like Brazil, India, and South Africa.
And of course, as we've seen travel restrictions lighten, some of those islands even may be impacted with tourism and visitors and whatnot. Well, we're going to pick up the discussion when we come back from this break. Dr. Strauss, just before the break, we were chatting about whether COVID will reemerge, it will continue on showing itself like the seasonal flu. So the conversation now returning to masks. In your opinion, should we all wear masks? And if yes, what is the best practice going forward?
I can't give an opinion that contradicts, or I can't give you an opinion that you should disobey public health in your community. I'm not in a position to say that. If I were making public health policy in your community, I would not recommend enforcement of mandatory masks. I think that again, it's a matter of being too heavy-handed with people who have not too much to fear. So having young, healthy children try to wear a mask for 10 hours a day is likely going to be a disaster. And those children had very little to fear of COVID-19. So I think that masks have their place. Obviously, I'm a physician. I work in the hospital. I see patients who are COVID positive, not many lately. And of course, I wear a mask, and I believe that it protects me in that situation. But that doesn't mean that everyone should be wearing it.
Okay, well, speaking to children specifically, since you brought them up, recently in Ontario, as you are aware, the education minister declared that children from kindergarten to grade 8 will return to school full-time. Actually, all children under 18 will be returning to school full-time, but only those in elementary schools in grade 4 to 8 will be required to wear masks. High schools, they definitely will, but only in elementary schools grade 4 to 8. So help us viewers understand how some versus all of wearing masks will help to keep people safe, or not at all?
So I suppose I can understand the rationale if the concern is that any particular child in school might have vulnerable people in their household, and therefore we don't want that child to be infected with COVID-19 because we don't want them to infect a vulnerable person. Suppose they live with grandma. But I think, again, that we're failing to try to identify the kids who have an important vulnerability, or the households that have an important vulnerability, and trying to enforce it, these mandatory masks on the 29 kids who don't have a vulnerable person in their household is A, likely doomed to failure. I can't imagine that a 9-year-old is going to succeed at this. And B, is probably quite unnecessary.
But just thinking out loud here, so if only the child with a vulnerable home circumstance wears the mask, would all the others, the other 28 children, for example, would they not still put that one child in their household at a risk by not sporting the mask?
We don't know what the percentage success of interrupting the transmission between the 28. So suppose 28 children in the class get COVID, and we're concerned about the possibility that they could give it to the one with a vulnerable household. We don't know what the percentage chance that each of the 28 children wearing a mask is actually going to be to decrease it. And I suspect that percentage chance is going to be much, much lower than putting the one vulnerable child in a mask.
Because I guess there's been mixed reviews, I suppose, or mixed research on this matter?
I would say the research is in its infancy, and I think that's being kind. Like most of the papers on mask wearing that I have read, and I've done my best to stay abreast of it, most of them are not good experiments. Many of them would not be published in normal time. So we're kind of rushing relatively shoddy science out the door. And so it's very hard to make clear predictions about how efficacious that will be. But my gut instinct is, even if you make the 28 children in the class, if you force them to wear masks, I still don't think it's going to work. They're not going to be able to keep it on.
Now, reading through the Hospital for Sick Children's report, there was one element that came up discussing herd immunity, and they thought children should return to school to help boost their immunity. Speaking of herd immunity, will mask wearing have any impact on that?
So possibly, and in both ways. The number of the percentage of the population that needs to be immune in order to have herd immunity is a function of how well the virus is spreading. So if masks do interrupt spread, you would potentially need a lower proportion of the population to have got COVID-19, to have gotten over it, to be immune, to claim that you have herd immunity. On the other hand, if masks interrupt the spread too well and no one gets it, then nobody's going to get immunity, at least not by natural means.
And with all the cleaning that we're hearing that's going to happen now in schools, and in the 20 seconds we have left, how do we build immunity, especially among children, in a progressively more sterile environment?
To answer your question, you're not building immunity. If everyone's wearing a mask and the environment is sterile, there's unlikely to be immunity, or at least derived from schools. So there won't be. If we manage to almost eradicate the virus, herd immunity will never come to be.
Okay, thank you, Dr. Matthew Strauss, for joining me today. It's been a great perspective.
Thanks for having me.
Welcome back. Before the break, we've heard some of the concerns about mask wearing and its effectiveness. Joining me now to share his medical opinion on why masks are the way to go is Dr. Dan Riley. Welcome, Dr. Dan. Firstly, how do you think Canada has fared with its response to COVID?
So I think I'd give it a B-. We've done better than a lot of countries, but there are countries that have done better than us. And certainly early on, there were some challenges getting PPE, some significant issues with what happened in our nursing homes. Mm-hmm. So we've fared fairly well, but we certainly could have done better.
Now, seeing how you've rated how we've done, I know masks were a bit of a discussion point earlier on in the pandemic. In your opinion, now that time has evolved, do you think we should all wear masks?
I think that if you're going to be within 6 feet of somebody who's not part of your household or your social bubble, then you should wear a mask. Because if you happen to have COVID-19 and you don't know it, and there's lots of patients that's the case, then you're making everyone around you safer. And so I think it's the kind thing to do for your neighbors, just in case.
And are they effective? Are masks effective?
Well, they definitely reduce the transmission rate between somebody who has COVID-19 and who may not know that they have COVID-19 and the people that they are physically close to around them. So there's good evidence based on the biology of the disease, which we understand better now than we did a few months ago, that it will have that effect.
Are there any cons that you feel to wearing masks?
Well, so I think the only con I can think of is if people think that masks are going to make everything better, and so I can forget about washing my hands, and I can forget about trying to avoid being in large groups, and I can hang out with everybody. As long as I just put a mask on, I'm going to be fine. Mm-hmm. Then I think that's a problem, because a mask reduces risk, but there's other things that reduce risk more effectively, like washing your hands and maintaining physical distance, avoiding large groups. There's all the other things that we also need to do. And if we think masks are the only thing we need to do and then we're good to go, that's a problem.
Yes, and I keep hearing from several, medical officers of health saying that, hand washing is really one of the most important things to do. And, I think perhaps as a society, we became sort of lax with that in the last few decades. So it's nice to have that reminder saying this is actually a good thing to do all the time, especially in a pandemic circumstance.
Definitely. It's something that we've gotten used to not doing, but it's something that we've trained all our children to do. Certainly every time a little one does anything, we get them to wash our hands. Sometimes us adults aren't so good at following our own advice.
Yes, we have to model that behavior. Okay, switching gears for a second, speaking of children, of the 36 Ontario epidemiologists and health experts consulted by Sick Children's Hospital here in Toronto, 2/3 said masks should be avoided entirely at the elementary school level. Why is this?
So there's a few things that contribute to that. One is that there's increasing evidence that children don't transmit the virus very well, so that the risk of transmission from children is quite small. And if children do contract the disease, it seems to be much milder in children. Now that's assuming that there's not underlying health conditions and other things. There's various caveats to go with that. If you're wearing a mask and you're not wearing it well, and you're constantly touching the mask and you're constantly touching your face and you're constantly touching everything around, if a mask causes you to touch your face a lot more, then that's a problem, because again, it's about getting it on your hands and spreading it around. So given how 4 and 5 and 6-year-olds tend to behave when you make them wear a mask, then it was thought that it was actually a bit counterproductive to do that. Now, if you've got a 6-year-old who follows instructions very well and can wear a mask really well, and maybe does an even better job than you as an adult and not touching their face and wearing it properly, I think a mask is still a really good idea. That's not your typical 6-year-old.
Right. So that might be some of the reasoning behind those recommendations from Sick Children's Hospital. So we've heard a lot in recent weeks about herd immunity. So will mask wearing by either adult or children, will that inhibit herd immunity?
Well, it depends. It's not clear that herd immunity is something that we'll ever get with COVID. If COVID is like chickenpox and you get it once and you never get it again, then herd immunity works as a concept. We certainly have herd immunity for chickenpox. If it's something like the common cold and influenza and the virus changes fast enough that you can get it every 6 months, even if you've had it before, then we're never going to get herd immunity. The common cold, we're never going to get herd immunity for that. So it would be, I think, very dangerous to expose everybody in society to this in the hopes that herd immunity is a thing that is real and that we're going to achieve it.
Right. Okay,
and
great.
so I think that certainly if we all got it and herd immunity is a thing, we would get there faster.
Okay, well, listen, Dr. Dan, thank you so much for joining me with your expertise on this matter.
You're welcome. Thanks for your interest.
Thank you. Stick around, we'll be right back. Welcome back. Joining me now to discuss our civil liberties and general thoughts on mask wearing is Dr. Scott Masson. Welcome, Scott. What do you feel policies should be within the mandate of wearing masks?
Well, I mean, I err on the side of freedom in general. I do understand that people are concerned about health-related issues, and so many people choose to wear masks. They do so in China, for instance. In many countries, it's sort of a standard policy for people to wear masks, but there's no effective or no demonstrated effectiveness of wearing face masks to deal with these sorts of things. So given that fact, it seems to me that there ought to be liberty to wear them or not to wear them. And these are not coming from me saying that. These are from the WHO even, that's saying this back in, June 5th. So very recently, that there's no demonstrated evidence that face masks are even effective at stopping the spread of these viruses.
So even though the WHO, the World Health Organization, you suggest that they said this on June 5th, but they haven't come down saying, well, don't wear them. We still think it's, I think, a good habit to be in, to wear the masks. It will provide something, no?
They are saying that. So there's no demonstrated usefulness. On the other hand, I guess in the same sense that in an operating theater, a surgeon will wear a mask in the sense that it will prevent, if you have a cough, the germs will not spread to the same distance and so forth. So I guess they have some limited usefulness in that sense, but they clearly can't prevent it.
Okay. Could mandating the wearing of masks be considered, and I think I can predict your answer here, but could it be considered an infringement on our civil liberties?
Well, I mean, it wasn't that long ago that in Quebec, they were mandating that people could not wear face coverings. And it was many people, myself included, who thought that this was an infringement upon civil liberties to mandate that people could not wear face coverings. And Philippe Couillard, the Quebec premier, said, we're just saying that for reasons linked to communication, identification, and safety, public services should be given and received with an open face. We're in a free and democratic society. You speak to me, I should see your face, and you should see mine. It's as simple as that. So says he. I would say that is in general the policy that most Canadians understand. We see people wearing masks as a threat, trying to hide something, whether they're Antifa or they're bank robbers, whatever. So, and there's a demonstrated effect on people's mental health to wearing masks as well. It's very hard for people with mental health disorders, developmental disabilities.
But let me just cut in for a second. I think it was, you referred to the Quebec Charter of Values. That Bill 21 in Quebec, that was mostly targeted towards religious communities, if I am correct. So people saw that as an infringement on their religious freedom or freedom of expression.
They did. That was my understanding, and most people saw it as particularly targeted towards the Muslim community, although they claimed that it was not, and it was more broad-reaching than that. But then, if one community wears face coverings, then it would rather seem that it would be directed towards them. But it's the same issue; it's religious freedom, civil liberties issue, and now I don't see how it is not the same issue that's being raised here.
That's a good point. What would you suggest then, given that, of course, we want to be responsible Canadians, and if there's some level of protection we can afford others or community by wearing masks, but at the same token, we want to respect one's civil liberties, what would you suggest would be a good path going forward?
Well, I think it would be nice if the politicians dialed back the tone of terror and fear and trauma that is going to come if one does not wear the mask. I mean, you can see it in people's faces and their eyes, which is the only thing you can see. There's a genuine anxiety and trepidation in people when they see somebody that is not wearing a mask. And that includes small children who, I mean, they have great difficulty wearing them if they're very small. So it seems to me that what it ends up doing is it creates a surveillance culture and a culture of fear simply by mandating it. It actually has an unintended consequence of creating and heightening anxiety, and it's particularly hard for children and people that, I mean, we get a lot from people's faces,
right? We definitely
in terms of gestures and tone and so forth.
Listen,
and I would.
I've got to cut you off there, and I'm so sorry we run out of time. But listen, Thank you so much for joining me, and it's been a pleasure.
As always, thank you.
Clearly, there is a spectrum of opinion on this issue. Some hold the position that science doesn't support the efficacy of masks against COVID. Others suggest that masks, at the very least, provide some protection, and that is better than nothing at all. While yes, our freedoms throughout COVID have been sacrificed, the intention has always been for the greater good. But does the end always justify the means? For Counterpoint, I'm Tanya Granick-Allen.